Merck More Than a Mother is a unique and the first of its kind initiative to empower an unprivileged segment of women in Africa, women who suffered infertility. They've been actually, if we be honest, neglected and mistreated and discriminated. In some cultures, women who cannot bear a child or be pregnant can actually be mistreated, disinherited, and denied access to food sometimes, to family dues, to actually be victim of violence, psychological and physical violence, pushed to suicide or killed. And this is a very severe situation. I mean, you will not believe it until you see and watch with us today the videos we are going to show you. And this is not going to be the right thing to ignore it and just let it be. That's why we created at Merck More Than a Mother initiative to say that women are more than mothers. In Africa, there is few numbers, it will shock you. One couple every 4 couples are infertile, which is a very high number compared to developed countries. But 85% of these infertility cases can be preventable. Can be preventable because it's due to untreated infectious diseases, which is due to many also practices, wrong practices we are advocating for, like child marriage, the infectious disease which is a result of child marriage, unsafe abortion, unsafe delivery, genital mutation, sexual transmitted diseases which cannot be detected early because it's misdiagnosed or for lack of awareness.
Merck is a well-known leader in fertility, and we have been in business for more than 20 years. We take pride of having developed and commercialized drugs that really changed perspective for couples that wanted to have a family and were confronted with infertility. So we have done so for 20 years, and most recently our strategy has gone from focusing exclusively on developing pharmaceuticals to offering a broader support to these patients and these families that has the dream of having a child. I believe this initiative, the More Than a Mother initiative, truly illustrates, first of all, our new strategy, so serving the patients in a holistic way, but most importantly, this initiative is actually bringing us back every day through each and every step we make, is bringing us back to the very heart of our mission. We help create life through everything we do around fertility.
As a country, we know that of all the couples attempting to have a child, between 10 to 15% fail to have a child. And of course, you all know how distressing it can be for a couple to attempt to have children and then they cannot have the child. So, of course, as a country, we have services available to help infertile women, but this is limited within the capital city in Kampala. And of course, we have just about 5 clinics available, but very expensive, that only those who are educated and only those who have the resources can actually go and get the services. And of course, in the countryside, if you move to the village, those women who are infertile do not know that their situation can actually be corrected for some of them. And others believe it is a curse. Others believe they have been bewitched. And so they live in that kind of state. So from the time we launched this campaign, we as a country, we as Ministry of Health are trying as much as possible to integrate fertility care services into the already existing healthcare services that we have.
Since the law is not in place in most of African countries, we had to make sure that we have that law to regulate ART in Kenya. And as we speak right now, I think we are the first country, is it in the whole of Africa, right? Sub-Saharan Africa to have brought the ART bill in the House, and right now it has been passed at the National Assembly. It has been taken to the Senate. And then from the Senate now, it comes back. If there are no amendments, then the president assigns on it and it becomes law. As you can see from the video, when I got my son, because we didn't have the law into place, I had to go through adoption. Yes, because I use a surrogate mother, and because we don't have that law that governs surrogacy, I had to go through adoption to adopt my own son. And it was a long process. It took almost 4 years because to them it was a new thing. Not that IVF does not happen in the country, yes it does. Not that people don't seek surrogacy services, yes they do. But then how do they get the documents?
Well, I think the story is extremely moving. Each and every story we show illustrates the point that we discussed before. Each and every testimonial of this woman is actually inviting us to continue to expand, to do more. I think we live in a world of empowered patients. We all want to make decisions for our health, and this is happening every day. So at the end, empowering these women to make their own decisions has a lot to do with us.
The issue of infertility is embedded in culture. The consequences of those cultural rules and cultural values are what you see from Grace and what you hear from our colleague Joyce. One of the key issues is that the cultural aspect in most African countries is that you inherit the wealth of most Africans are embedded in land and property. And so, culturally, a girl child or a woman inherits from where she's married. And when you are married, you are expected to give children in the place where you're married. So in Africa, when you don't give birth to a child, culturally, you are supposed to go back to your home. And that is the story you saw from Grace, where she stated she was married. When she could not have the child, the husband told her to go back. And when she couldn't go back, she had to look for another opportunity. And when you go back where you are born after you got married, you are not even allowed to inherit any property or land from where you're born, because your brothers and the children of the brothers are the one entitled to inherit.
I am very, very grateful on behalf of Nigeria to Merck, because what Merck is doing for Nigeria by this initiative is very, very huge when you compare the population of Nigeria. Nigeria is the most populous country in Africa. We have a population of about 170 million people. And when you consider the fact that 1 in 4 of the population is supposed to be infertile, so we are saying we have about 40 million infertile people in Nigeria, which, I mean, is a wake-up call really for even me as a medical practitioner, because if not for this Merck initiative, I wouldn't have put much attention to infertility like that. So I congratulate Merck for this God-sent initiative. We are looking forward to Merck coming to Nigeria in September.
Yes.
September 27, when I will dress like a woman, since I'm the only female or male ambassador.
Yes.
So I'm really looking forward to that. But before then, I hope to have introduced the ART bill to make sure Kenya is not the only popular country in Africa that has introduced the bill successfully. We would have advanced a bit before you come in September, by God's grace.
Very good.
We have programs in which we go into developing parts of the world, and we point at basic infertility. What is the infertility workup that any physician or any health provider, doesn't have to be a physician, is able to do? And how does one do a sperm analysis? Because how does one know that a male is infertile? You have to have easy access in order to do that. And those are areas that we look at. The advocacy and how we avoid the stigmatization that occurs, really, the parliamentarians here have told us how to do that. You have to tell the public that there's a problem, and you have to tell the public that there are things that you can do about it.
In Africa, my pain, which led me to create a magazine called Health Awareness, was that many patients come to that clinic, and if you see the women, the level of torture they have experienced, laparoscopy, endoscopy, all the scopes have been done. All the HSN, hysterosonography has been done. And when you look at the man for the first time, there's no sperm. And you wonder, why was this woman being subjected to all this level of intervention? And at the end of the day, by the time you are looking at this woman, those interventions have created problem on her, such as damaged blood tubes and endometriosis from infection. So that has made me to realize that with the advent of in vitro fertilization, which we were the first to pioneer in Nigeria, with advancing technology, some of these patients were still not getting pregnant. So the peculiarity for Nigeria is, first of all, awareness and education. Education to prevent sexually transmitted disease. Education to prevent the nutritional toxins that can lead to some of these things like fibroid, or that can cause some environmental, some damage to the reproductive organs.
First, when I was invited to Kenya about a year ago, same sort of perspective that I had, but I was struck to the fact that high infertility was really quite of much worse than what we had when I started the IVF program about 10 years ago in Jakarta. We see so much of similarity in developing world, particularly when we are talking about the stigmatization of infertility towards women. And when we had this discussion about how much we want to be involved, particularly we're doing a reasonably busy center, about 2,000 cycles per year in our unit. And we have been training our human resources on our own all this time. But given the challenge that was given, I thought I didn't have too much time to think, because this would be a very, very exciting moment for African society. Because, of course, when we're looking at infertility treatment in developing countries can be very different, particularly when we are managing patients with different perception and also different environment to the developed world. And I see that the government, from the government viewpoint, that what you point out about previously infertility and infertility management and population management is completely different.
You know, we are working now on some keys some key solution is really to train and employ community-based health officer. You know, in Africa we have this health officer everywhere. These people would provide essential primary care at the village level, and we are also trying to speed up the last setup of our mobile phone-based telemedicine, which is a kind of digitalization, as you know. This will connect health officer and a rural patient with a specialist, and in the cities, or a specialist even in Indonesia, even, if you like. if you still have some time.
I really like to thank everyone for your patience and being with us. And I think we have finished now the panel, and we can invite everyone to have nice dinner, and we can interact together now offline after we come down to our table. Thank you very, very much. Thank you.